Health and Allied Workers Indaba Trade Union will this morning march to the Gauteng Department of Health's offices. They're demanding that all contract workers be made permanent. They're also calling for the employment of experienced and qualified managers at health facilities. Haitu will be joined by the Independent Liberation and Allied Workers Union as well. Let's bring in Haitu's General Secretary for more on this discussion. Lerato Mthunzi joins us via our video link this morning. Lerato, thanks very much indeed for coming on. It's great to have you with us on the program on this issue of labor brokers in particular. That's part of the concerns of Haitu and the other union, the Independent Liberation and Allied Workers Union. There was a promise from the Health MEC not so long ago that the department would end the use of labor brokers, wasn't there?
Good morning and good morning to all the viewers. Indeed, one of our demands today is that the use of labor brokers for services and also for security, any form of middlemen that the health is using should definitely be abolished. You are right. We have been hearing lip service from where we are sitting, where the MEC has made a commitment to end labor broking, but that comes with a great responsibility. It's not a matter of waking up one day and saying, I will no longer be using a...
All right, we do apologize for the connection to Lerato. Lerato, apologies, we lost you for a second there. Your picture froze. Let's give it a try. Continue what you were saying. It's one thing making a promise to end labor broking, but how does that play out in reality?
Yes.
Yeah.
Absolutely. When you remove those nurses that were using agency, you need to augment that with ensuring that you employ nurses permanently. So you cannot target close to about 3,000 nurses not to immediately cease their work, because those numbers add to the hands on deck and actually tries to speak of the shortage that are grossly. Yes, labor broker must move, but the department must take responsibility in employing healthcare workers permanently. And this is not only for nurses and security, it also includes EPWP. That program was supposed to be a one-year program, give qualified young people in our country a skill and then absorb them into the system and employ them, not keep them for 15 years in an entry-level 3.5 employment while you are exploiting their labor and their skill and what they...
So, Lerato, 50 billion rand is the figure that we have. That's what the department is spending on labor broking, having this middleman in place insofar as employment is concerned. Towards the end of your first answer, you alluded to what this means for workers in the healthcare sector to be subjected to these labor brokers, the fact that they're on contracts, they're not being made permanent. What does it mean for them in terms of income and job security?
Basically, just to paint a blanket picture, it's just money going into one individual or a company pocket rather than actually being there to service not just salaries but also benefits and really look out for even future benefits such as pension for those workers. So imagine working for 15 years for a department, and when you have to retire, you're just going to be told goodbye. There's nothing for you because you are not employed by them. And the labor broker said, look, I was just using you on a locum or as a temporary measure. You're not actually even my employee. So workers, healthcare workers particularly, I think it's the first time in healthcare in many years where we are seeing even doctors, even nurses not being able to be employed by the Department of Health. And this is unheard of. We need to make sure that the Premier particularly takes a clear stance, not just on media to say we'll end labor brokers. Clearly demonstrate by insourcing security, by employing those who've been on EPW programs for more than a year, and also taking those who are on contracts and nurses and all other skill sets, particularly those who are in the administration, clerks, cleaners and so forth, and absorbing them into the system and taking responsibility for their IR, HR, and all labor-related issues of these employees.
So Haitu represents, your union represents some 22,000 members. Given what you've just said about the demands on the one hand and the length of time it might take to make these changes, do you reckon there's another strike looming in the sector?
Absolutely. I think it's this one. It's more of a class action strike, class action lawsuit that is looming, because I can tell you right now the government of the day has failed healthcare workers, but in their venture to failing healthcare workers, it has failed our communities. We are not seeing patients getting the quality of healthcare that they should be getting, because forever when we are talking, in this on Newzroom, we are forever talking about shortage of staff. We need more hands on deck in order for us to prepare, not just for NHI, but to also continue servicing those lives that cannot afford medical care that is privatized.
Yeah. It feels like a distant memory now, but COVID-19 was not very long ago, and our healthcare workers was at the forefront of dealing with the worst parts of the pandemic, government hailing them then as the heroes of the pandemic here in South Africa. Has that all but been forgotten?
Absolutely. I think healthcare workers have been really used, and I think, for lack of a better analogy, we've seen healthcare workers being used like syringes, if not worse, like condoms, and when they are being done with, they are discarded. And this is exactly what we are marching about today. We are marching because the exploitation cannot continue on our watch. Someone must say something, and this needs to get the attention it deserves.
Okay, so you're marching to the Department of Health in Gauteng, to the offices today. You know, what can the department say to you today to allay these concerns?
Look, last year, if you remember very well, same month on the 16th, we were marching because the department was threatening to cancel immediately the contract of those who were on COVID-19, forgetting that those people actually have been placed in all different manner of department, not just for COVID, and actually they were addressing the issue of shortage. They had promised us last year that the short-term goal or the short-term resolution would be to extend the contracts by a year. Those contracts were extended by a year up to now, towards the end of the month, and we were promised that in the period of a year, the department would be able to look at permanent solution, and the permanent solution is permanent employment, is absorption of this skill set, and this does not only include the people that they left in the last year's system, it includes everyone that was actually even left out last year. And I think what is important is to note that looking at the sunk statistics, even if every nurse out of all the 280,000 plus nurses were to be employed, or the number of healthcare workers on the HPSSA roll were to be employed today, we would not even cover the shortages. There's still a big issue of getting more skills from external, or even training more and more healthcare workers in our government if we are to actually do any dent in improving the healthcare system.
Lerato Mthunzi is Haitu's General Secretary, and she says there is another strike looming in the healthcare sector. Lerato, thanks very much indeed for joining us.